This is the treatment group video for depressive and bipolar disorders. My name is Dr. Ryan Bell. My client's name is Jason Halston, and he is 37 years old. There is only one differential diagnosis, and that is cyclothymic disorder. And then there is one primary diagnostic feature, and it is cycling between depressive and hypomanic symptoms occur with this disorder, but lack the severity of a major depressive and hypomanic episode. And then for the story of Jason, he's 37 years old. He's a computer salesman who is seeking psychiatric help requested by his wife. She told him that if he didn't figure out what was wrong with him, she'd file for divorce. Jason claims that his wife is everything to him, but he feels there is nothing really wrong with him. He admits that he does have his good and bad days, but dismisses this because this is true of everyone. When asked to describe his good and bad days, he describes the bad days as sleeping 12 to 16 hours a day, lacks energy, confidence, and motivation. He's been having these bad days for as long as he can remember. He says that these periods don't really last that long, just around 3 to 5 days. Then the good days return. During the typical good days, he feels confident and very sociable. He also indicates that his thinking sharpens. When asked what his wife takes issue with, he explains that when he's having his good days, sometimes he may drink a little too much and use marijuana, and she's also caught him cheating on her a few times. He admits that he actively sought to keep his promiscuity from her, but rationalized his secretiveness by stating that women just can't keep their hands off him because he's irresistible. He states, "I really am a powerhouse of a man, and it's my duty to share myself with as many women who desire me." He complains that his wife didn't understand this obvious fact. He admits that he uses the alcohol and marijuana to help him sleep when he's in his good day period. The good days would last anywhere from 1 week to a month. And in school, when he was younger, his grades were pretty spotty. When his mood was up, he would do well, and when his mood was down, he would do poorly. This had the teachers and his parents thinking that he had an inconsistent lack of achievement. This pattern is also seen in his computer sales job. When he is in his bad days, it is not unusual for him to call in sick, or when he does go to work, he lacks performance. When he is in his good day cycle, his sales are off the charts. Although considered a charming man in many social circles, he alienates friends when he is hostile and irritable. He typically accumulates social obligations during the bad days and takes care of all of them at once, starting on the good day period. For the multiaxial diagnosis, axis 1 is cyclothymic disorder, axis 2 and 3 are none, axis 4 is relationship and jeopardy, and work difficulties. And his GAF score is 60. And then for the theoretical perspectives, there is only one of them, and that is biological perspective. Cyclothymic disorder may be caused from a genetic inheritance from Jason's parents. There is the notion that genetic factors that contribute to the development of bipolar disorders lead to the development of cyclothymic disorder. Jason may have a family history of bipolar disorder, suicide, or alcohol dependence. Jason may also have a deficit of serotonin or norepinephrine contributing to his depressive symptoms, and an excess of norepinephrine leading to his hypomanic symptoms.